It's really wonderful to hear from you about the different aspects of medical system that you have brought into for the care of COVID. One small question, or maybe very important question, ma'am. How do you think, or what do you think are the major bottlenecks in integration of, like when you, if you want to post COVID, when you are deciding to bring Ayush systems into mainstream in a more effective manner, so that it can be utilized in a much better manner in future. What do you think are the bottlenecks, and how do we overcome that?
Okay, so when we did this, what we find is that while we were able to, I think as we say, there's this word carpe diem, or seize the day. So this time COVID gave us that opportunity to seize the situation to actually allow it. Otherwise, till then, while you do want Ayush also, I think this thing of harmoniously having both systems coexist and giving the choice to patients, an informed choice, and not completely stopping one in favor of the other, or vice versa. That's not the purpose. I think it should be a very balanced choice that people can exercise and choose. So while that was very difficult earlier on, even during the time of what we now refer to as seasonal flu or swine flu. I remember we used to have several marathon sessions, even at the level of the minister, where we were trying to get both the groups, make them sit together, the alternative medicine group on one side and the allopathy is on the other side. It would almost seem like a very, very ready to fight with each other, very polarized, fanatic group on either side. But this time I was pleasantly happy that sometimes there is that little sweet spot of time when there is a readiness, willingness for things to germinate, acceptability. That did happen. So I think the fact that they were allowed into the wards, and the fact that people accepted, and the fact that these palpable, significant improvements have actually been documented is a good shot in the arm. However, I think some of the bottleneck issues here are that when we have these herbal drugs, there is still, in terms of quality control, standardization, we probably need to do a little more work collectively, all of us together. There are standards, there are methods, but I think it's better to do a little more. Also dosages, because this kind of codification, if we can have, a full encyclopedia of pharmacology for the Ayurveda, I'm not sure if it exists, but if there can be some kind of a documentation coding for different things, for different compositions, different types of bodies, these are for the weight of the body, these are the dosages. If there can be some kind of a common minimal mutual agreement by some of the top scientists of Ayush, that also will lend a lot more, shall I say, belief. It will lend a lot more credibility to the whole thing. Similarly, randomization, and when you talk of really these good studies with a control group, randomized control trial, etc., that needs a lot more rigor, which perhaps is missing in terms of the Ayurveda system of education now. So maybe if we can inculcate some of these methods of research, even in the undergrad and postgraduate students, both in the MBBS side and the Ayush side, and get them to collaborate. Like very recently, I was talking to somebody who graduated from Banaras Hindu University. So, of course, she happens to be a lady who graduated several years ago, perhaps in the 80s. But she was mentioning that there was a lot of emphasis both on the Ayush methodology there, as well as the Allopathy. So in the hostels and dinner tables, when they would all interact, I think the exchange of ideas, that faith in each other. So I think this sort of thing, if we have students coming to the medical education MBBS colleges from Ayush and doing one semester here, and vice versa. So, and that will happen if you really have Ayush colleges also getting accredited, maybe A-grade colleges. If the quality really improves, I think everybody, we see this happening world over. I mean, why is it that in Europe and other countries, you have allopathy doctors wanting to come and learn alternative medicines to be able to fold it and plow it back into their own system? We should make these pathways of learning open here as well. Similarly, I think the number of patients, also sometimes this willingness. So when all this happens slowly, we are, I think, getting more and more, we are entering this territory of getting more and more acceptability. So patients, inducting patients, getting willing for statistical significance, etc., is also sometimes a challenge. So that is there. And also, you see, a lot of these Ayurvedic medicines have pungent tastes, smells, and they have certain things which are very characteristic. So if you have to develop a placebo for a control group which has similar properties, that also calls for some attention, some care. So some of these nuanced things require time. And also the duration, unlike allopathic interventions, which are generally faster, you just have to administer certain medicines. Sometimes the duration of treatment in the AYUSH methodology spans several months, perhaps sometimes even running into a few years for conditions for which allopathy may not even have a cure. But so whether people have that patience to really endure it for a long time and be open to study. So these are some of the bottlenecks, but they're certainly not impossible bottlenecks. But if we all, apply our collective wisdom, intelligence, and see how to solve and crack these problems, I think we should be able to do it.
Thank you. I think it is a fairly wide area of bottlenecks, but not so bottlenecks. So they are simple, or probably if you think properly and act, I think we should be able to overcome that. And I think that would be a lot of responsibility for policymakers and decision makers like you to help Ayush systems to reach that level. Thank you, ma'am.